One, action.
Just tell me when you guys are live.
Oh, we're live.
Good. Hey guys, it's Dr. Emer. We're actually in Manhattan today, the past couple days, and I haven't had chance to go on lives. We've been doing a lot of treatments, but we have one of my long-term patients here who's doing volumization of the middle face, and I'm trying to go real gently using silicone for just facial volume loss, and we do this in small quantities. I know everybody nowadays, the tendency is to want immediate gratification. But the thing about silicone, if we do small injections like we just did, I'll be right there in a second with more. You tell PJ to bring me a bunch more of these needles, 27 gauge. If we do small injection points, what we call micro droplets, it will build over time and look very good long term. We started many years ago, and now we're kind of at a point where it's up to him. The result is good, and we can keep building by doing more. I just am very conservative. I won't do more than a cc or two at a time, because the studies show that if you do that, you're fine. If you do more than that, there can be a major problem with risk of lumps and bumps and inflammation and things like that. So we don't want granuloma formation, we don't want scar tissue to develop, we just want a nice subtle volumization. And so we do a little grid-like pattern, deep breaths. The hard part for him, and for me because I feel bad, is you can't do numbing inside the silicone. So it's only topical numbing that we can do. And you can see again, grid light pattern. We just do small amounts. I'm going to finish this row here. And you can do this for acne scars, you can do it for facial trauma, you can do it for this scenario where we're doing for lipoatrophy or volumization. And what happens with the silicone is, last few, I want to go to the other side, is it forms collagen production around it in the skin. Good. Okay, switch that ice pack right now. Go ahead. Put it right in here. That's better. Right there. Good. Sure. You're good. Right there.
Okay.
Switch the needle. So silicone injection helps build collagen over time. So each time we do this, I can feel where it is, where that collagen production is, and I kind of want to go around it and or build on it. See, the ice helps a lot.
It does.
So we pre-iced this side so he has less pain. And again, we're doing a grid-like pattern, very small amounts. I will say when this is done well, and I've had patients who are in their 70s and 80s who've been doing this for many years, they look so young because the collagen production is high in their skin. So we just do this slowly. I see him every few months when I'm here, and over the past few years he's been doing it, and since we've been doing it more consistently, the building of collagen has been substantial. You just don't want a reaction. Hold right here for a second, Nick, just with your hand. Let me get a little bit more. The last one. You guys can see the silicone's a very greasy sort of oil, so it has to be injected properly. hits every place, so it's a lot of pokes. And when done right, just build slowly. Now I've seen many doctors inject this improperly, large volumes or in the wrong locations. I wouldn't do this in lips, I wouldn't do this in hands. I would only do it as little depot injections. You can do it for acne scars and get a really substantial result. You're doing great, you're almost there. And we're blending this back portion. Like I said, unfortunately, you have to do little bits at a time so you don't notice it as much immediately. Almost done on this side. There's always a lot more bleeding with the silicone. And there's only one place in the US that you can actually get silicone legally, and you have to be approved. So I want you guys to know that. I've been doing it for many years, and that's why we have it.
We're at 6 minutes. We're gonna log out.
What do you say? Okay. So that's it, you guys. It's silicone injection for facial volumization. Stay tuned for more here in New York.